Thank you for joining us today to learn more about HIRTA's Health Connector. This initiative is designed to meet the diverse needs of various populations, especially those in underserved communities, in accessing healthcare services. Our goal with Health Connector is to streamline the process of scheduling healthcare appointments and arranging transportation, ensuring that every resident has enhanced, equitable access to healthcare. We provide service for anyone for any reason, but Health Connector provides an emphasis on groups such as individuals with disabilities, people with low income, older adults, veterans, and those with limited English proficiency. The Health Connector initiative reflects HIRTA's mission of ensuring that no one is left behind in accessing its industry. We are excited to collaborate with our first medical partner, the Dallas County Hospital, to broaden the impact of Health Connector and make a tangible difference in the lives of those who need it. Our aim is to empower individuals to navigate their healthcare needs with greater independence.
The pilot for Health Connector is funded by the USDOT Joint Program Office ITS for US program. The goal of the USDOT's ITS for US deployment program is to identify ways to provide more efficient, affordable, and accessible transportation options for underserved communities. Expansion of the future projects will be funded through other opportunities.
As part of our collaboration with Dallas County Hospital, we're excited to introduce a dedicated kiosk within the hospital. This kiosk will offer a convenient and accessible way for individuals to book their Health Connector trips. Eligible users will still have the option to schedule trips using the HIRTA On Demand app or the web portal. However, for those who may not have mobile data or are already at the hospital and need a ride home, the kiosk provides an efficient option.
We'll be showing you a video of the kiosk shortly, but first, a brief overview of its interface. To use the kiosk, just enter your account details, choose your destination, and you'll be ready to go. Now let's take a moment to see how the kiosk works.
To book a ride, first be sure you're registered as a Health Connector rider. Then, select Book a Trip. Enter your name, phone number, and email. Make sure this matches what's on your HIRTA account. Select your destination. The origin will always be the hospital. Enter any notes, add guests, or personal care attendant. Click Next and your ride will be automatically scheduled. To check a previously booked trip, simply input the same details you entered to book your trip. Click Next, and you will see your estimated pickup time. It's that simple. Now, get ready for your ride.
In addition to the streamlined booking process, HIRTA and Dallas County Hospital have introduced NaviLens technology both within the hospital and on HIRTA vehicles. NaviLens is an innovative navigation system designed to assist visually impaired individuals in navigating public spaces with ease. It utilizes colorful QR-like codes that can be scanned from a distance by a smartphone camera, eliminating the need for precise focusing. Once scanned, the NaviLens app delivers audio feedback about the location, directions, and other relevant information. This technology is widely used in public transportation, schools, medical facilities, on products, and in various other public spaces to enhance accessibility. NaviLens offers a straightforward and an efficient way for users to receive real-time orientation and guidance.
The NaviLens app is specifically designed for individuals with low or no vision, providing essential navigational assistance. NaviLens Go is intended for a broader audience, including those who are not visually impaired. Although both apps use the same NaviLens codes, they differ in the features. NaviLens Go enhances the overall experience by offering text and interactive features, making it a valuable tool for anyone looking to explore and learn more about their surroundings. While NaviLens focuses primarily on accessibility for the visually impaired, NaviLens Go enriches the user experience for everyone, providing additional information and interactive elements beyond basic navigation. Though NaviLens and NaviLens Go serve different needs, they work together to make public spaces more inclusive and informative. Anyone interested, regardless of whether they use HIRTA or Health Connector, can download either the NaviLens or NaviLens Go app from the Apple Store, Google Play, to take advantage of these tools at no cost.
On the left, you see an image of a HIRTA rider and her service dog Wishes, who kindly helped us test the NaviLens codes. She is visually impaired and relies on her smartphone for navigation. Using NaviLens, she was able to enter the hospital and navigate her way around with ease. At the entrance, she scanned the area with her phone, which identified various locations such as the reception, waiting room, and women's bathroom. By selecting the women's bathroom option, the app provided auditory directions and distance information. We received excellent feedback from her, highlighting how transformative this technology has been. She shared that she frequently gets lost in medical facilities, and NaviLens could be a game changer for her. On the right, you'll see an example of a NaviLens code at Dallas County Hospital. The colorful square represents the NaviLens code. The bottom section includes the HIRTA logo, a traditional QR code linking to useful Health Connector resources, the Dallas County Hospital logo, and the NaviLens logo. We'll discuss the Health Connector links in more detail later.
There are two types of NaviLens packages available. The first is the free NaviLens kit, which is provided to medical facilities, libraries, schools, and associations. These kits include codes for common areas such as restrooms, waiting rooms, elevators, and more. While these codes are available at no cost, the content they provide cannot be customized. Dallas County Hospital is using these free codes as shown in the presentation. The second option is the paid NaviLens package, which offers several customization features to tailor the codes to specific needs and enhance the user experience. With paid NaviLens codes, you can do several things. You can customize text information to tailor the descriptions, instructions, or other relevant text linked to the code. For example, the code on the screen reads out HIRTA Bus 2237. Personalize the audio feedback. This feature is crucial for visually impaired users, and it allows for clear and precise information. You can customize the audio to include different languages, voice tones, or specific sound effects. You can adapt the visual design. Although the core design of the NaviLens code is standardized for optimal scanning, you can customize the surrounding elements, such as adding logos, colors, or branding to integrate the code into your environment. For instance, the code can be incorporated into a branded design. You can enhance interactive features. The code can be set up to trigger various actions, such as opening a website, playing a video, or even starting an augmented reality experience, expanding its functionality beyond just providing information. You can integrate geolocation data. This allows the code to provide context-specific information based on the user's location, such as direction to nearby facilities, the next point of interest, or location-based promotions. HIRTA uses paid NaviLens codes on our buses so riders can scan the code to receive real-time information about their ride.
Here's an image of the NaviLens codes for the women's and men's bathroom at Dallas County Hospital. NaviLens can easily read and differentiate these codes from up to 60 feet away. On board Health Connector vehicles, we've installed an infotainment system that allows us to create and manage presentations in real time. Currently, the system displays an overview of the Health Connector, presentation about Dallas County Hospital, and messages from Dallas County Public Health. The infotainment system supports a variety of media, including images, videos, audio, and PowerPoint presentations. And we will collaborate with partners to incorporate their messages as well. Additionally, the system features GPS-triggered events, enabling specific media to play when the vehicle enters a designated area. This capability allows us to tailor messages based on location and provides opportunities for advertising. For instance, if a local restaurant wants us to provide its specials or new menu items, we can set up the system so that the ad appears on the screen and the bus is within a certain distance, just 3 miles from the restaurant.
To be eligible for Health Connector trips, a rider must first complete the registration process. This can be done online through our website at the Dallas County Hospital or with the assistance of a Dallas County Health Navigator. During registration, we'll need the rider's name, email address, if they have one, phone number, and whether they live in Dallas County. We also collect optional information to help gather data for the Health Connector. It's important to note that living outside of Dallas County or not identifying with any of the target populations listed does not disqualify anyone from using the service. This information is solely for data and trip collection purposes. The question about living in Dallas County is included because the Health Connector is piloting in Dallas County.
Throughout the Health Connector project, we've been fortunate to collaborate with some great partners. One of these partners, Arcadis, developed a system that integrates seamlessly with the hospital's electronic health records, or EHR. This integration provides both HIRTA and hospital staff with access to a dashboard where they can verify whether a patient has a trip booked. If a trip is not scheduled, hospital staff can easily arrange transportation for the patient. We'll provide more details on this system later. The dashboard is also valuable for monitoring situations where a patient might be running late for an appointment. Hospital staff can check if a trip has been scheduled and determine if there are any delays with the ride. We want to emphasize that no medical information is stored in the dashboard or required for booking.
Here's an overview of how riders can schedule their trip using the HIRTA On Demand app. First, create an account if you haven't already done so. Next, enter your pickup and drop-off locations. Schedule your ride by choosing the Depart At or Arrive By options. Then select the ride option that works best for you and book your ride. As part of HIRTA's commitment to inclusivity, the HIRTA On Demand app supports multiple languages.
Here's an overview of how riders can schedule their trips using the online link for HIRTA On Demand, which is available directly on HIRTA's website. The process is similar to using the HIRTA On Demand app. Start by creating an account if you haven't already, then enter pickup and drop-off locations, choose your preferred timing with the Depart At or Arrive By options, and finally, select and book the ride that best suits your needs. Then here are some additional steps on how to schedule through the web portal. Now let's explore how rides are scheduled on the back end. This is how HIRTA books rides for riders. Additionally, Dallas County Hospital staff have been trained to schedule rides for patients as well. It's worth noting that the HIRTA's ride booking platform for health staff offers a limited view and doesn't display all available information. To start, use the link to HIRTA's ride booking platform to search for the rider and access their profile.
This is the rider profile. Here you can view the rider's contact information, ride history, and any future rides scheduled. To book a trip for a rider, select Book Ride, search for the desired ride, and enter the necessary details, including pickup and drop-off times, as well as the origin and destination.
Select a relevant funding source. This could be access to care, the rider's payment information on their account, or payment due upon pickup. Finally, it's time to get the ride proposal. There are 3 possible scenarios when booking a ride. 1, pickup proposals. The scheduler will receive proposals with a 20-minute pickup window. Choose the option that best fits the rider's schedule. 2, no availability. This may occur due to the current schedule or seat availability. In such cases, it may be necessary to schedule the ride for a later time. Or 3, waitlisted for recurring trips. If the ride is part of a recurring schedule, it may be waitlisted. The rider will be contacted up to 24 hours before the ride if there's a change in the ride status. That concludes the overview of HIRTA's Health Connector. For more information on Health Connector, visit www.transithealthconnector.org. For more information about HIRTA, visit www.ridehirta.com. Last but certainly not least is the Health Connector link tree. This is the QR code on the NaviLens sign I mentioned earlier. We also use the Linktree QR code on marketing materials. This Linktree houses links for everything a writer needs to get the most out of Health Connector. It includes links about Health Connector and HIRTA, about NaviLens, and links to download it, the Dallas County Hospital and Mercy One patient scheduling, and more. This pop-up website provides writers a one-stop shop for everything they need for an inclusive mobility experience from beginning to end.
Thank you for watching. If you have any questions, feel free to reach us at 1-877-686-0029. You can email us at healthconnector@ridehirta.com. You can also visit www.transithealthconnector.org for more information. Thanks again for your time today and have a great day.